Hi, my name is Simon Moore and I'm part of the Credabl Queensland team. Today, as a follow-up to our In Conversation with Credabl webinars, I have joining me Dr. Naga Annapureddy. Naga is an intern at the Prince Charles Hospital in Brisbane and is on the AMAQ Queensland Council of Doctors in training. Thanks for taking the time to join me today.
Thank you, thanks for having me.
Credabl and AMAQ Queensland are partners and we have joined with AMAQ Queensland this year to provide support, and part of that is providing educational and content to help the members of AMAQ Queensland throughout their careers. And I thought now was a really good time to catch up and have a chat about medical graduates moving into their internships. Obviously at this time of year, everyone's getting their intern letters and starting to prepare.
Yeah.
Naga, how did you prepare yourself over the Christmas break?
Yeah, look, honestly, the first few weeks didn't prepare at all.
Yep.
Worked so hard for 5 years, just you finally made it, just relax, take your time, do things that you didn't get to do while you're in medical school. But closer towards the start of the year, I learned basic things like my approach to chest pain, abdominal pain, how to prescribe basic pain relief, anti-nausea medications, and communication skills. It's a really big one, how you present, say, a case in an ISFAR format to your seniors. It really makes a good impression if you've got those down pat.
Yeah, definitely. And what were your expectations moving into your internship year?
Yeah, so a lot of people tell you that internship year is basically a glorified receptionist job.
Okay.
And it's just a lot of paperwork, so that was my expectation.
Okay, and the reality of it?
A lot of paperwork.
A lot of paperwork?
Yeah.
Kind of fitted?
Yeah, but look, once again, that's not even half of it. You just learn so much. It's great. You'll be surrounded by experts in their field, your senior registrars and consultants. Even, nurses, allied health staff, you'll just learn so much from them and you build great friendships. It's one of the best years of your career. Fantastic.
And COVID obviously changed, I guess, what an internship was for you compared to people in previous years. How was COVID an impact on you? And also, I guess, this week we had the AMAQ Queensland Women in Medicine breakfast, which had a big focus on COVID and mental health and well-being. So how did that have an impact and how did you look after yourself through that?
Yeah, one of the biggest things that I noticed is that previous years it's quite a tradition to do end of term drinks and start of year drinks, things like that, just where people can catch up, junior doctors, and build networks and friendships really. And unfortunately we didn't get that opportunity. So it was a bit difficult in that sense. You didn't get to make as many friends as you would have, for instance. But in terms of looking after yourself in that period, it was taking the opportunity to just go home, relax, step away from work, and do all the little things that you could do, like if you have any hobbies, painting, something like that.
Enjoy the downtime.
Yeah, enjoy it.
Yeah, definitely. So I guess every job and career has its highs and lows. What would be a high and a low from your internship that you've been able to learn from?
Starting with a low, you have a lot of responsibility as a junior doctor, and you don't realise what that means until you're in the midst of it. One of the, I guess, not necessarily lowest, but hardest points was when I had to tell a patient's wife who had come to visit her husband that he had unfortunately passed away. That was quite difficult. But on the opposite end of the spectrum, the highs, you every day that you've made some sort of difference to a patient, whether it be small or big. And coming into the next day and seeing something like a thank you card is always great. Yeah,
definitely. And those, the low that you talk about there, they're the sort of things that I guess there's nothing you can really do to prepare yourself for that. And I'm sure for interns moving into what you've gone through, there's certainly, I'm assuming, a lot of support in place for you as a doctor in that position.
Definitely. Like you said, you can't prepare for things like that. It's all just experience. And I do encourage anyone in that situation or any sort of situation where they do feel like they've been pushed out of their comfort zone to debrief with someone.
Absolutely.
Whether that be with a peer or a mentor. and just talk through it.
Yeah, definitely. So I guess over the last however many years you've been studying, you've read a lot of books, but textbooks, I'm assuming. So have you had the opportunity, a bit of downtime, to maybe read a book that's had an impact on you this year?
Yeah, definitely. This year I think is one of the first years where I've actually got back into reading. The first one that's not quite a textbook, but in the vicinity of medicine, is This Is Going to Hurt Bad, okay? Which is a great read. It's really about junior doctors and the NHS and the severe effect on their mental health. But it just really serves as a nice reminder to make sure we look after ourselves. I guess another one that I've read is called The Night Circus, which is completely different. And the only reason that sticks out of my mind is because it took me a year to read. But it is a nice book. It's a fictional one.
It's not it's not about a night shift on an intern's night shift or anything?
No.
Alright, cool. And maybe just finally, have you got sort of maybe 3 top tips that you can think of that would help interns this year?
First one, just relax. Just don't worry about it. You know more than you know, and when you do get into it, you'll learn it on the job and you'll have so much support. Secondly, bring a lot of snacks. There'll be a lot of days where you just, don't have the time for lunch, unfortunate, but the reality. But as long as you have, a few bars on you, that's always helpful. And lastly, just take everything as a learning opportunity. For instance, if you're in ED, nurses are great. They can do all the cannulations. If you're on Gen Med or Gen Surg, rather, they can do the nasogastric tubes. But put your hand up and say, hey, can I have a go at this? Can you watch me do this? And just try and take every opportunity that you can to get some more experience. Yeah,
fantastic. And I think, obviously, to all the graduates moving into their internship, the important thing is, reach out to people like yourself, the AMAQ Queensland for support. And if you've got any questions, or like you said earlier, feeling a bit isolated and unsupported, make sure that you do reach out to people and look after your own well-being as well.
Yeah, definitely.
Awesome. Well, thank you so much for taking the time to join us. We'll do a little COVID elbow bump to finish. And have a fantastic rest of 2020.
Thank you. You too.
Thank you. Cheers.